everybody. Today I'm going to talk about panic. Panic. Woo! Nobody likes that. I wanted to ask you guys a question first though. Is your anxiety causing you a lot of discomfort? Have you ever wondered the difference between panic and anxiety? Well, according to anxiety disorder statistics, here they mentioned that there's more than 2.7 million people in the country that have a panic disorder. Anxiety can be a constant issue for many people. It's like a pit in your stomach. It makes you feel like life is unbearable at times. Panic, on the other hand, is feeling impending doom or having a complete meltdown, which occurs when you're having anxiety at an all-time high. The weird thing is about a panic attack symptom is that sometimes it can make you question whether it's anxiety or if it's a medical condition that's gone haywire. Right now, we're going to talk about panic anxiety, but I'm also going to talk about when it should be alerting you enough to seek medical attention. The weird thing about panic attacks is that you could be doing great 1 second and have a panic attack, or you could have them come on when you're having stress. I mean, that is super confusing, right? I'm going to go over some symptoms that can also be health issues as well as panic attacks. If you at any time or experience any of the following and don't feel as if it is a panic attack, please seek medical attention. However, I'm specifically talking today about panic attacks. So here we go. Take a deep breath. Here are some 10 symptoms of a panic attack. Chest pains. Panic can cause your muscles to tighten. Chest pain could give you the sensation that you're having a heart attack. Here's the thing. The key is to see if the pain goes away and if it comes and goes. If the pain doesn't go away after some time, you might want to go seek some medical help. Go to the hospital, call 911. If it goes away and comes back, goes away and come back, chances are it is a panic attack. Number 2, difficulty breathing. Not being able to catch your breath can be awfully terrifying, especially when it comes on all of a sudden. Sometimes people have the feeling of hyperventilating during a panic attack. Here's the thing about a panic attack is that many people breathe too fast when they're panicked or having lots of anxiety. Once again, I'm going to mention difficulty breathing could also be a symptom of other medical issues or conditions that should not be ignored. Number 3, sweating. I went to the gym this morning and I've been sweating today. Sweating is often a way to cool down the body. When you're working out, sweating is good. We look for the sweat. However, when the body is under feelings of intense fear, sweating can come on rather quickly. Let's say you're just sitting here chillaxing and all of a sudden you feel sweaty. That's a concern. Next one is dizziness. Many things can cause you to become dizzy. You may become dizzy during a panic attack. Sometimes people report as if they're feeling a merry-go-round and they can't get off, or they have the bed spins or something like that. Whew. I've been dizzy numerous times, and not only because I'm blonde, but because I have equilibrium issues sometimes. So sometimes that could be an issue when getting dizzy. Again, to rule it out, go to the doctor, see if it's equilibrium, see if you have an inner ear infection, or see if it's something like a panic attack symptom. They are super uncomfortable, aren't they? If you've had a panic attack and you felt dizzy or any of these symptoms, please write them down below. While you're here, hit like and subscribe. Number 5, you might feel like you're going to pass out. You might get tunnel vision. You might be scared that you're going to fall down. Most of the time, if you feel like you're going to pass out, it's good to sit down. Take some deep breaths in through the nose, out through the mouth. Number 6, we're at number 6 already, chills. It might make you feel like your body is shaky. The rush of adrenaline and cortisol can cause you to feel all sorts of things. Usually, a panic attack, you might get shivers and chills, and they come and go as your hormone levels come back to normalcy. Chills or your body feels shaky is the rush of adrenaline and cortisol. I've already said that, but it's important to note. So usually in a panic attack, if you're having shivers and chills and it's coming or going, chances are, like I said, you know it, it could be a panic attack. Okay, we're to number 7 now. You're here. Thank you for being here. Heart racing. Some people report that having tightness in the chest or feeling like the heart is beating out of their chest. Nobody likes that. Sometimes they may feel like the heart is skipping a beat, or that it might be off rhythm a little bit. This can become super, super scary. If you're already having a panic attack and you're starting to feel heart palpitations, this might make you feel that there is other things going on medically. Since it's hard to figure out if it's a panic attack or if it's a heart issue or something else, it's always best to err on the side of caution. And if you feel this way, go get medical help. This brings us to number 8, freeze. If you're unable to move, sometimes you can get fearful or freaked out that you cannot move. Do you remember learning about fight, flight, or freeze? Well, this is the freeze part. Number 9, fear of losing control. Fear that you're going to die. Eek! There's an oldie song by a group called The Platters. Am I aging myself? That's called The Great Pretender. Look it up. It's a great song. Anxiety often makes you feel like things are not real. Anxiety can be a pretender. Sometimes people with panic disorder can feel as if they might die. Fear of losing control, fear that you're going to die is never good, no bueno. So let's not do that. If you're starting to have thoughts like that, then I want you to take a deep breath and ground yourself. Remind yourself that you are in a safe place and that you're going to be okay. Never underestimate the power of a deep breath. Let's take one right now as we go into number 10. Number 10, detachment. According to the Calm Clinic, detachment can be a mental, emotional, or physical in nature. In therapy, sometimes I see detachment as dissociation. Sometimes feelings of detachment is a coping mechanism. So let me show you some hacks that might help you with your panic attacks. Come along with me. Are you coming? Let's go. We're going to look at our senses. One thing to do if you're feeling really panicky is to distract yourself by using your senses. The next one I'm going to describe to you is using some sort of essential oils. Let me show you how this works. So here you see I have several different types of oils. They're good for lots of different types of things. This one is lavender, and lavender is really good for relaxation. So what I would do is I take some of this and I'd put it on my wrists. Just smelling it makes me feel very, very relaxed. If I really needing it and I need to get about and do some stuff, I might put it right under there, right underneath my nostrils, so it's readily available. Again, doing that in conjunction with deep breathing, pretty darn good. Butterfly tapping, this can work as well. So what I want you to do is pretend this is a butterfly. Aw, isn't it cute? You're gonna cross it across your chest and you're gonna slowly tap
from one side to the next. And while you're doing this, you guessed it, we're gonna deep breathe. So this is bilateral stimulation. We've talked somewhat about it on our channel. It is a resource technique for when we're doing EMDR, but this is also a very good grounding technique and a very good relaxation technique. I tell my clients to do this all the time. So you can do it up here as like a butterfly tapping, or you can go across your chest and do it like this, just tapping back and forth, or you can get your knees and you can do that really slow from one side to the next, always being aware of your breath. Breathing and controlling our breathing is huge when it comes to relaxation. I hope you enjoyed this video as much as I did. I hope you found it entertaining, informative, and very useful. Hopefully you never need those tips and tricks to manage your panic attack, but if you do, there you go. Don't forget to hit that like button, and we'll see you again next time. Bye!